everything that happens in healthcare is understandable to a layperson. It's extremely complicated to do, but it's not complicated to understand. But when you put all these little pieces together, cardiac surgery and health promotion and other things and so on, you put them together in a social system, all hell breaks loose. So the problem is really a management or a social problem and not a technical problem.
There's another very large element that adds to the complexity of the current healthcare system. In addition to the marvels of the modification of acute and severe illness, which have become available since 1948, we have a remarkably expanded world of healthcare in which we must succeed. And that includes health promotion and prevention in addition to treatment. These are huge topics, and it adds a challenge to every healthcare system because what it asks us to do is to begin with the child perhaps before birth and intervene throughout the life cycle before illness arises for the prevention of illness. Managing all that creates extraordinary challenges that weren't even imagined a decade ago. We now know that if we do not organize the healthcare system, we cannot provide optimal care. Yes, they're remarkably similar. While there continue to persist endemic conditions which are unique to particular geographies, the world, like the economy, in healthcare has grown to be almost a single entity.
We see this now with Ugandans in the class and Americans and Brits and Kuwaitis and Canadians and so on. We have them in the class. They have no trouble understanding because the issues are common. Look, take a hospital. One of the big issues in a hospital is responsibility for the purchase of equipment. And what you have is a single decision to purchase equipment divided by the technical dimensions, which the physicians or very specialized physicians take responsibility for, and the fiscal or financial dimensions, which the managers are supposed to take responsibility for. So the physicians often don't care about the costs, and the managers don't understand necessarily the technologies. And so we take these decisions and divide them in two and create very unnatural decision-making systems, and that's common in hospitals no matter where you are. We want as wide a range of people with on-the-ground clinical type experience, in other words, having lived healthcare and not only managed it, in a wider variety as possible. So if you look at the people in the program, it's really quite remarkable because it's in the mix. We want them to come from Asia, we want them to come from South America, we want them to come from the entire world, North America, Europe, everywhere. Because the greater the mix in that class, the more interesting and the more everybody's going to learn.
We need a new cadre of people who are experts in the invention and management of the very complex healthcare systems which now exist in most countries of the first world and the third. And the program should allow the development of such a group of experts who in turn will create a network for learning, for knowledge transfer that will benefit the entire world.
The whole philosophy of the program is not so much our pearls of wisdom as faculty. Yeah, we drop in our pearls of wisdom, but it's that people are coming with an awful lot of experience. The average age in our class must be about 45 right now, and it ranges from early 30s to mid-60s, okay, and the whole range. And so we've got an awful lot of experience in that class, and we want people to bring that experience to bear on those kinds of issues, not only to solve it for themselves and their own communities and their own institutions, but to also make a contribution towards the understanding of healthcare issues broadly and through publication and so on. So we want this to be an ongoing forum for the big issues. Practices are different, but they're not just different marginally. It's kind of like we're doing things in a whole different way because of some ideas we got. Because those ideas are not just conveyed through a lecture, they're lived in the program. They experience those ideas through other people and how they've lived them or how they're thinking of living them. And people come back and say, we're just doing things differently now. We've really turned that one around. An MBA is great for learning the business functions. Healthcare has business aspects, but it's totally different in so many important respects. We do everything that they will get in those other programs, but much, much, much more. Because the focus is on healthcare, the focus is on people learning from each other and having experienced people in that classroom. We bring the absolute top people in the world into this program to meet the class and work with the class, not just lecture at the class, but work with the class. It's a completely different philosophy and a completely different approach. Well, this started with our business program years ago, where we said we couldn't use the ordinary organization of business programs, which is around the functions, marketing and finance and accounting. We needed to build around managerial aspects. We call them mindsets. So we did a Harvard Business Review article on this called The 5 Minds of a Manager. And basically we said there's managing yourself, what we call the reflective mindset. There's managing organizations, we call it the analytic mindset. There's managing the world, the system, and we call that the worldly mindset. Managing professional and other relationships, we call it the collaborative mindset. And then managing processes of change, the action mindset. And so the philosophy is managerial. Now we've taken it into healthcare and it works perfectly again. It's another way for people to see the world, for managers to see the world in their terms. One of the things about the mindsets, about the modules, I think that's important to understand is people don't quit their jobs to come on this program. They stay on their job, they go back and forth. Every 4 months or so they come for a 2-week module, and those modules, mostly they're held in Montreal. One of them right now is held in England. There'll be others that will go to different parts of the world depending on who's in the class. And the whole philosophy of the program is not to get a better job, but to do a better job. One of the problems, obviously, is that to bring in people from developing countries, we need donors and foundations and so on. Someone who might say, gee, you know, I really have a close connection with Sri Lanka or with Fiji or I don't know where, and I'd like to sponsor 3 or 4 people to go on this program. And we're as a faculty happy to talk to them. Well, if they look at what they spend on healthcare and they look at what the costs of mistakes in healthcare are, and the costs of all the politics and the crises and the false starts and the social re-engineering that doesn't work and the reorganizations, the cost of sending a group to really rethink this is minuscule compared to the millions and millions and billions of dollars that are wasted on efforts to change the system. McGill's medical faculty is one of the top handful in the entire world, and McGill's management faculty is probably the most innovative group or business school in terms of pedagogy, in terms of approaches to management education anywhere. So the combination is really charmed, I think.
With our colleagues, we have decided that there was a great opportunity in the IMHL program, and both faculties, by history, by temperament, by expertise, which rarely exists in one university at such a level, have the capacity to make a major contribution to the training of this new group of experts in international health.
It's not a business model, it's a management model, and we're focusing on management, but we're bringing an awful lot of healthcare. And we've got absolutely tip-top people in the healthcare field very deeply involved with this program from beginning to end. We want this program to be the #1 forum for ongoing discussions of major healthcare issues in the world, period.